Hi, this is Dr. Krishna Raj Ganesh Narayan, a periodontist and implantologist. So many times patients observe something, a black spot on their teeth, which is nothing but a start of a tooth decay. And they don't feel any discomfort except that the black spot is present. Now this black spot becomes bigger and they start experiencing sensitivity. Still, they don't think it's necessary to go to a dentist. Then the cavity starts becoming bigger and they start seeing a hole in their tooth. Then occasionally they start developing severe sensitivity and still they don't go to the dentist. Then finally, one day they get a sharp shooting pain in their tooth. This pain aggravates when you're lying down, and then you find difficulty to sleep, inability to chew, and the sharp shooting pain. At least then some people visit the dentist. But there are some people who even at that time choose to ignore it and start taking painkillers. Then the pain subsides and after a few days they develop a swelling in their mouth. And then they realize that I cannot postpone this any further and I have to go to the dentist. And that's when they think they need a root canal. So this is from a patient's history and signs and symptoms point of view. But from a dentist point of view, it's very clear that the teeth has got three different layers. The first layer is called as the enamel, where when the decay involves that, you just see the black spot with no signs or symptoms there. When the decay progresses to involve the second layer of the tooth, which we call as the dentine, that's when you start experiencing sensitivity, because this dentine is not as hard as the enamel, and the dentine also has some nerve endings which get stimulated to cold and heat, and you start experiencing sensitivity. When the decay extends beyond the second layer and into the third layer, which we call as the dental pulp, and this is where your blood supply and nerve supply to the tooth comes from. Once this is affected, that's when you get the sharp shooting pain. And even then, when it's not treated, then the infection spreads to the bone and that's when you start experiencing a swelling. Now, when the decay is restricted to enamel, which is the first layer, or the dentine, which is just the second layer, we can escape with just a filling. But when the decay has involved, the pulp is inflamed and it dies, then you have no choice of doing a filling. The only way to save the tooth then becomes the root canal treatment. One of the main problems with eating food is that when they start getting fermented and the bacteria in the mouth start dissolving the enamel, which is there due to the presence of acid, mainly lactic acid that has been secreted by these bacteria, and they start dissolving enamel. And this is basically the start of an infectious process. Once the enamel gets dissolved and the dentine gets affected, and then it progresses to the dental pulp, which is purely an infectious etiology, then you will need a root canal treatment. So more often than not, your sensitivity and your pain and your sharp shooting pain is all mainly caused due to dental decay, which is basically a bacterial infection. In rare situations, sometimes due to old age or due to abnormal brushing habits or bruxism or abnormal habits, the tooth gets worn out. And then the wearing away of your teeth can start exposing your dentine, and this can cause sensitivity. And then if this wear is uncontrolled, and then it will involve the pulp, and then again you will need a root canal, but that is not an infectious etiology. And sometimes there can be some sort of a trauma to the tooth if you fall down or if you experience a hit to your tooth. This will affect the nerves and the blood supply to the tooth, and eventually the tooth will die because of this trauma, and that would also necessitate a root canal. But that again is not an infectious etiology, but that's due to trauma. But if it left untreated, it can lead to an infection or a secondary infection over a period of time. So these are some of the common reasons why you would need a root canal treatment. Now, can a tooth which has been involved with the pulp be treated by a root canal, or is a root canal really necessary, or is there any alternative to this treatment? Now, unfortunately, once the infection has progressed beyond the dentine and it has involved the pulp, and if it's just at the beginning of the pulp, or if it is nearing the pulp, we can do a treatment called as pulp capping, and this is a temporary treatment to see if the pulp recovers by itself. But if it is not, then the only option is to do a root canal treatment. The only way to save that tooth would be by doing a root canal treatment. The other alternative is to remove that tooth. So there are only two choices at that point. Either you remove that tooth by extraction, or you try and save that tooth by doing a root canal. There's no amount of filling that can be done in that place that will be of any help to you. Because we do get a lot of patients who say that, I know that there is a cavity, I know that it is deep, can you not just do a filling instead of doing a root canal? But it cannot be done if it is involving the pulp. For all you know, if you do an attempt of filling in such situations, it can result in a big swelling, and that's not a good thing to do. So a typical question is that we get is, antibiotic really necessary when we do a root canal treatment? More often than not, a root canal treatment does not need antibiotics. So you can actually do a root canal treatment without having any need for an antibiotic. But there are certain situations where the infection has been there long-standing for a long period of time, and people don't come immediately whenever there is a problem, right? They wait until they can't wait anymore, and then they come. So a clinical situation, if we find that there is a lot of pus in that area, or if there is below the roots, if the infection is kind of spread into the bone, or if sometimes the patient is a diabetic or some other medical situations or systemic conditions that can alter the immune response or the healing response, it's always preferable to give the patients antibiotics to assist them in recovering from this sort of an infection. But yes, is it a must and should that every root canal treatment needs an antibiotic? No, it's not that way. But yes, some situations definitely require antibiotics that need to be given either concomitantly or can be started a day before we start the root canal. So can you wait 2 weeks for a root canal treatment? Well, I need to be a magician or I need to be an astrologer to answer this question. Because if you can wait 2 weeks, why not wait 2 months? Why not wait 2 years? What are we waiting for? Are we waiting for the tooth to regrow by itself? Or are we waiting for the new dentine or new enamel to form there? See, my point is very simple here. A lot of times people say that if I have a stomach pain, right, I've ordered too much food, I've eaten some food outside and I've got some stomach pain. I don't always have to go to the doctor, right? A couple of days the body recovers by itself and I become all right. I don't necessarily. But a tooth, you think if there's an infected tooth there and it's a decayed tooth, does a tooth regrow by itself? It doesn't. So the earlier that we get it done, the better it is. It's lesser painful, it's cheaper, it's lesser efforts, and better chance of recovery. So why would you wait 2 weeks? I wouldn't wait even 2 days. If I know that I need a root canal, I might as well get it done, because there's no way that the tooth is going to come back to becoming normal without undergoing any treatment. So a treatment delayed always increases the pain, the cost, and reduces the chance of success. So I would not wait. So a lot of times we get infected teeth which are beyond repair, and we may not be able to save such teeth. And how do we know that which tooth we cannot save? See, why we do a root canal treatment? A root canal treatment is basically done to save the tooth, right? And why do you need to save the tooth? You need to save the tooth because you can use it for function, for chewing, right, in your day-to-day life. But if the tooth is broken down beyond repair, if the tooth is broken, let's say at the level of the neck, or if the tooth is fractured, it's not the point of doing a root canal treatment. We can still do a root canal treatment. But the point of doing a root canal treatment is that your tooth can be saved and can be used for function. And if it cannot be used for function, then it's better to just go ahead and remove that teeth rather than attempting a root canal treatment. So in cases where the infection has gone beyond recovery, if the tooth is broken or fractured beyond repair, or if the tooth is cracked in the center, or if the infection is too high, which will prevent us from giving you a good prosthesis over the treated tooth, then it is always better to just extract the tooth and look in for the better replacement therapies.